All right, Doc, and we're live. So, Doc, I have Amy and Dr. Entwistle here. Okay, so, Doctor, today...
Wait a second. Welcome back.
I'm sorry.
Thank you guys for joining us.
Sorry.
We appreciate that. Amy and I are very excited to bring you some great information today. Okay, Leslie, you got some questions for us. Everyone wants to know. What are your questions for today?
Okay, Doctor, so a lot of people have been talking about sciatic nerve pain, okay?
Yes.
They want to know what exactly that is. What is sciatic nerve pain?
Okay.
How do you get diagnosed with it?
Okay.
Does it affect only one leg? Does it affect both legs? Does it affect only the right leg? Basically, does it just do one? Another thing they want to know, what would be the best treatment for it? And if there's anything for them to do at home, if they have some kind of flare-up or some kind of pain.
Okay.
Now,
we've got some great
can
information.
it be self-diagnosed? No, right?
Well, you know what? Nobody goes to the doctor anymore. What do? We Google it.
Correct.
Dr. Google is our main doctor. That's our family doctor. Now, some of the information out there is good. Some of it's not so good. Some of it's incomplete. Okay? So that's why we're coming to you today to try to answer some of those questions. Okay? So you have to be very careful what you read on the internet. And also, sometimes you have to be careful what your friends tell you. They mean really well. Okay? They mean well, they care about you, but you have to make sure that you get the straight scoop, okay? So, sciatica. Amy, I'm just going to have my lovely model just stand over here for 1 second, okay? Let's take a look over here, Leslie. So, this is the spinal and cranial nerves that we see here. So when someone says sciatica, what they're really referring to is the sciatic nerve pain, okay? Pain that goes along the course of the sciatic nerve. So the sciatic nerve is made up of a number of nerve roots that come from the lower part of our spine, and they traverse down the back of the leg. So when someone says they have sciatica, what they're really saying is, hey, I have pain that's going down the back of my leg. Okay, as you can see lit up right here. Hopefully that comes through through your camera. Okay, so that's really what they're saying is I have pain going down my leg. Now, in answer to your question, can you self-diagnose? Well, yeah, I guess if you say you've got pain going down your leg, technically, that's sciatic nerve pain, all right? Now, one leg, two leg, both legs, it can vary. It depends, right? It depends what's causing that sciatic nerve pain, because you can have it down the left leg, it can be down the right leg. It can sometimes vary, right? Some days you might think, oh, I've got it in my right leg today. Then maybe next week it's down the left leg. So it certainly can vary. It just depends, again, on what's causing it. Well, so what can cause it? Well, typically it's going to be pressure or impingement, okay, or pinching, right? Pinching of the nerves that make up that sciatic nerve that goes down the legs, okay? So what can cause the pinching? Well, Fred's going to help us today, okay? All right, so what can cause the pinching? Well, that pinching can be due to nerve irritation because the bones are not moving the right way. Okay, so these are the nerve roots. Let me just orient you a little bit. So if we take a look at the spine, that's looking at the spine from the side. You guys are looking at the left side, I'm looking at the right side. Here's the front of the body, here's the back of the body. I know it looks very strange, but you've got one of these, okay? All right, so hopefully, all right? I know you guys do. All right, so there we go. Looking up from the side again, this represents the base of the head, so right back here, okay? Brain sits up here, controls the body through the spinal cord, which is this big trunk line of nerves that goes right down through each of the vertebrae and then sends off these spinal nerve roots. So they come off in pairs. One comes off to the left, one comes off to the right. They're actually bundles of nerves that then spread out even further and control everything inside of us. Okay, so now that we're oriented a little bit, by the way, these are the vertebrae. These are the bones. They're called vertebrae. They're separated by discs. Those are the cushions between the bones. You've heard of slip discs, bulging discs, herniated discs, okay? Well, that's what whoever is saying that is referring to, okay? Those are the discs. Now, we talked about what can irritate it. Well, if the bones are not moving the way they're supposed to, that can cause nerve irritation, okay? The other really common cause is either a bulging or a herniated disc. So what does that mean? Well, a bulging disc is when a disc will actually move a little bit further out than it's supposed to, and it can irritate these nerve roots, okay, that are very, very close to the disc. You can see the proximity there. That is close. Also, if this disc is bulging, it can also, if it's a little more severe, it can be a herniated disc, which if you think of the disc like a jelly donut, it's where some of the jelly is pushing out from the center of that donut. Okay, I happen to really like jelly donuts. Okay, or it could be a bagel if you like bagels better, where the cream cheese pushes out. Okay, all right, so back to the spine. All right, so this disc, if it's bulging or herniated, can irritate or pinch those nerves. It could also push straight back and irritate the spinal cord itself. All right, hitting a number of nerve roots. That's when you can sometimes get that sciatic type nerve pain going down both legs. All right, so often though, it's going to be to one side or the other, and that's going to then correspond to the leg down through which you get that radiating or shooting type pain. All right, so that's what causes it. Typically, it's going to be coming from the spine, impingement right here. There are some times when it can happen in the pelvis due to muscular issues, but that's much more rare. Usually the origin of that pain is from the spine, and therefore when we go to correct it, we look back to the spine. Okay? All right. What was your next question there, Leslie?
Hold on, Doc. I wrote them down for you.
So
that way I wouldn't forget.
We talked about, well, it's good to write things down, Leslie, especially you're getting older now, so the brain cells, you know.
Correct.
Be careful with that.
Thanks, Doc, for throwing my age out there. So we talked about, you basically explained what sciatic nerve pain is, what sciatica is.
Yes.
They wanted to know how you can get diagnosed with it.
Okay.
If there is something that you specifically have to do, what x-rays do, something like that.
Okay.
Would something like that be able to tell you this?
Yeah, probably if you're getting pain, okay, pain that moves away from the spine, what we call, the technical term for that is peripheralization, meaning moving away from the spine towards the periphery or down into the extremities. Whenever you get pain like that, whether it's happening in the arms or the legs, you really should get checked, okay? You really should find your chiropractor, give them a call, get in and get checked, okay? Super important, because you want to know what the origin of that is. It can be a number of different causes, and it really should be diagnosed, and the more pain is moving away from the spine, the more serious a condition that is. So it needs to be checked and addressed, okay? At least find out what's going on, exactly what's causing it, find out what you need to do to correct it. Then you can decide whether or not you want to do anything to help that particular condition. Super, super important though, to get checked. Let's find out. If a patient comes into the office and they've got, in our office, and has sciatic nerve pain, we're going to do a thorough exam. We're going to do a number of orthopedic tests, neurological testing. Often we will also take some x-rays. We do digital x-ray right here in the office, so it minimizes exposure, maximizes the benefit of those x-rays and the information that we can glean from them. All right, so you want to go through those steps, find out exactly what's going on. Then we can come up with a game plan to help relieve that pain, to help get those nerve roots healthy, to help get you back to doing the things that you want to do. Because really, do we want to be out of pain? Yes, but what we really want is to be able to do the things that are important to us, whether that's work or play, running around with the grandkids, chasing after our girlfriends, whatever it happens to be, okay? All right? That's what we want to do. We want to be able to wash the car. We want to be able to, you know, swim in the pool. We want to be able to grill and you know, go out, you know, a little salsa, okay? All right? Whatever that happens to be, that's what we want from our bodies. Everyone says we want to be healthy, but really what we want is we want what our health allows us to do and have a higher quality of life. That's what it's all about. And we want to do that long term. So taking care of our bodies is so critical. Now, the last question I think you would ask, Leslie, is what can we do, okay, to kind of help ourselves? We're all about here in the office helping our patients be as self-sufficient as they possibly can be, okay? So one of the best stretches that you can do, all right, is what's called the McKenzie Stretch. All right, it was developed by a really intelligent guy down in Australia, okay, Robin McKenzie, and we've adopted that and kind of modified it very slightly in order to give our patients the maximum possible benefit. Now, you're wondering why we have Amy here with us today, okay? Not because she just looks good, okay? All right, okay, she's got to work on a nice tan here in the summertime, right? But rather, Amy is going to demonstrate what the McKenzie Stretch is, and we're going to talk about what that does for the body. So before she lays on the table, okay, we're actually just going to take a look at the spine again, all right? The favorite position for the lower back, the strongest position and healthiest for the lower back is a really good arch, right? A really good arch in the lower back, which basically, Amy, just turn a little bit more to the camera. There you go, okay? So a really nice curve down here in the lower back. Super important. Why? Because what that does is, if you look at the discs are in front of, remember this is the front of the body, are in front of the nerve roots, okay? All right, we'll use this one here because it's a little easier to see. Now, if we keep a good arch in our back, you can see it kind of wants to keep those discs away from the nerve roots and away from the spinal cord that's in there. All right, so that's what we want to do. So the McKenzie Stretch actually will help us do that. Now, watch what happens if our lower back, instead of having an arch, okay, if it gets bent forward. Now look at that. Doesn't it look like this disc wants to get pushed back against this nerve root? All right, it looks like it's kind of wedging here and pushing that disc posterior or backward. Well, that's where all the problems are, right? That's where the nerve roots are. That's where the spinal cord is in there. So we don't want that disc coming back. We want to keep it forward. So that's why extension or an arch in our back, look at that, right? It moves that disc right away from the nerve roots. That's what we want to concentrate on having. So this stretch we're going to show you is a great way to help increase, okay, that arch in our lower back. So, Amy, if you would go ahead and lay face down on the table for me. All right, now, first of all, that's a few things to realize, that this is not an exercise, okay? When we get into a position like this, what do we think? Amy's going to do a push-up, right? Not a push-up, okay? Super important to realize that we want everything relaxed. We don't want any tension in the lower back, no tension in the buttock, no tension in the legs. Everything is going to be really relaxed here. What we're doing is, this is a stretch, okay? So what Amy's going to do, okay, Amy, come on up for me. She's going to extend up, okay? Kind of lock her arms out, and she's going to be looking up at the same time. Again, you can see this creates a great arch here in the lower back. Now, there's no tension here in Amy's lower back, none in the buttock, and none in the legs. Everything is nice and relaxed. And there's no tension in her core either, in those stomach muscles and the abs. Everything is nice and relaxed, and that's exactly what we want to maximize the benefit. So now she's been holding this for a few seconds. What we like to do is come up and hold it for a 4 to 5 seconds, okay? Here she comes back up again. Okay, she's very good at this, okay? So now holding it, right? And if you lock your arms out, basically when you come up, if you just kind of turn your elbows in without moving your hands, what that does is it locks the elbows, and now Amy doesn't have to use her arm muscles, her triceps, these muscles back here in the back of the arms. She's just kind of resting on those straight arms. Okay, come on back down again. Excellent. Okay, and when you're ready, we'll come back up. Okay, now, in the case where you try to do this the first time, it might be a little difficult to extend these arms completely. That's okay. So Amy, show us like a halfway position. Even if you can get, in fact, let's go to the elbow position. Okay, so if you're doing this for the first time, you can see Amy's on her elbows. All right, so she's extending up as high as she can go, but instead of being on her arms, she's just resting on the elbows, and this is a great way to start, okay? Because getting up straight on your arms like Amy is doing, quite frankly, that's a little challenging to do. Okay, isn't it, Amy? Yes, a little bit. So there she is, she's arched. Again, no tension, no tension, no tension. Everything is relaxed, okay? So she's feeling that good arch in the lower back. And again, she's still getting some good benefit here, even though she's not able to extend her arms. All right, now, when you're ready and want to try to extend those arms out, then you bring the arms back, you're in a good position, arms are about shoulder, slightly more than shoulder width apart, and come up. Now, say you can only come up halfway. That's okay. Try to keep everything nice and relaxed, and again, hold for that 4 to 5 second hold, and that 4 to 5 second hold should be a slow count. So here's how we like to do it, okay? Amy's going to come up, I'm going to count 4. Let's say this was number 4. We like to count 4, 4, 4, 4, and 4. All right, and back down. So that was a 5 second hold, and we said the number of the repetition we were on 5 times. All right, and we did it slowly. The reason we say that number, so the next one is going to be what? Help me out here.
5.
5.
5. 5. 5. And 5.
Amy's a quick study, okay? She picks up on this stuff like lightning, baby, like lightning, okay?
Do it all the time.
All right, so there she goes, right? The reason we say the number that we're on?
To remember what number we're on.
That's right, so we don't forget. Because as we're doing this stretch, it's like we're thinking about other stuff, all the things we got to do later, things that went on during the course of the day, and we're going to forget what number we're on, okay? So this, by just saying it, and we want to say it out loud, and a nice slow count.
7, 7, 7, and 7.
Fantastic. Great. Awesome. Amy, thank you very much. That was perfect.
Very
Okay? All right, so you've got an idea how that stretch goes. Now, how often should you do it and how many repetitions should you do? Okay. Initially, let's do once a day. Okay? Let's try it once a day and see how that feels. Now, how many repetitions? 8 to 12. Okay? The reason we want to start off with a lower number is just to kind of get our arms used to it and get used to that motion. All right? Then we can work our way up to 12, sometimes even 15 repetitions if you can do it. Again, working up to a 5-second hold, a nice slow count. Okay? Saying the number of that repetition 5 times. All right? So super important. Once a day, okay? At your house, you're not going to have one of these, okay? So you want to do this on the floor. All right? You're not going to have a table on the floor is the way you want to do it, not in a bed. All right? The bed's way too soft. These memory foam things, it's like doing a stretch on a marshmallow. Okay? You're not going to get the same benefit. It's not stable. It's actually going to be harder on your arms because you don't have something solid that you're pushing against. All right? So super important stretch. Now, here's the one little warning I want to give you, okay, when it comes to doing this kind of stretch. If you're doing this stretch, just like Amy was doing there, okay, or however you can do it to the best of your ability, and you start to feel pain moving away from the spine. In other words, say it goes to right here at the top of your buttock, and then as you're doing this, you feel it move down into the back of your knee or move down all the way to your foot. I want you to stop, okay? Stop it immediately, all right? Because that's what's called peripheralization. Then you've got to come in and get checked. It's not something you're going to be able to do on your own. Okay, very important to come in so we can determine exactly what's going on, because sometimes we've got to do some modifications of what we're doing to help correct that type of problem. Okay? Questions? What do you think?
It's good, Doc. Now, chiropractic adjustments, when they come here, will help with the sciatic nerve pain, and we have other things here that can help if it's something more severe.
Absolutely,
correct?
Absolutely. What we want to do is, and this again, why it's so important to come in, okay? I mean, there's only so much you can do on your own, and chances are this has probably been something, come on, let's be honest now, that you've been dealing with for a while, okay? You know, what most of us say is, you know, I have this back problem that comes and goes, okay? Well, guess what? All right, the problem's not going anywhere. What's coming and going is the pain, all right? Some days it's just more irritated than other days. Some days you might feel pretty good. Does that mean you are good? Of course you're good, but not healthy necessarily, okay? The problem typically doesn't go anywhere unless it gets fixed, okay? So super, super important. What else do we do here in the office? We do chiropractic adjustments. We talked about the adjustment last time on live. What does that do? It helps to realign the spine, take the pressure and the pinching off of the nerves, get the bones moving the way they're supposed to, and get everything healthy. When we get the nerves healthy, the body functions the way it was designed. All right, what else can we do? We do actually a lot of exercise. We're really big on that. Exercise and stretching here in the office. We have a spinal which is a mechanical traction table, which is very, very effective. We also have, for the more severe conditions, especially when a disc is involved, we have computerized spinal decompression. All right, check our website out at painfreeorlando.com to get more details on that. We also have therapeutic laser therapy along with what's called MyAct, or myofascial acoustic compression therapy. Does that sound cool or what? I just like to say that, okay? Again, a very, very effective therapy that can really help with certain conditions, okay? So, hey, we've got a lot to offer. We got a lot going on here. We got a lot of things that we can do to help you. Obviously, you have to help yourself, all right? Very, very important. You can try this McKenzie Stretch at home. Please be careful with it. Remember everything we talked about. If the issue does not disappear, okay, then what you need to do is you need to pick up the phone. Give us a call. All right, 407-344-4878. You guys know the number. All right, or get in touch with us online. We'll get an appointment set up with you. We'll get you checked out. All right, we only get one body. All right, if we don't take care of it, where are we going to live? Come on, we know this stuff.
Now, Doctor, I got one last question.
Yes, one more question. Thank you, Leslie.
They asked on Facebook Live, is McKenzie better to be done in the morning or in the evening?
Okay, fantastic question. Okay, my answer to that would be yes. All right? Yes. And what do I mean by that? Okay? We want you to do it. If the time you can do it is in the morning, fantastic. Okay? If the time you can do it is at night, wonderful. If you can graduate to doing them both, even better. Okay? In the morning, I would just tell you to be a little more careful. Why? Hey, you just woke up. Okay? The discs tend to swell a little bit overnight. Okay? They're hydrophilic, so they attract water. Okay? So they're a little bit more swollen, which is why sometimes if the disc is involved, it hurts more in the morning. It takes a little while to get out of bed and start moving. Okay? You try to brush your teeth, you can get stuck in that position. All right? And we'll talk about toothbrushing, teeth brushing on another episode. Okay? Live. Okay? Because I got some great information about that. Right? Remember, be true to your teeth or they'll be false to you. Anyway, I'm getting on that topic. I got to get away from that. Anyway, so very, very important. You can do it in the morning or at night. You can do either. If you said to me, what would be the best, and you could do either, I'd say nighttime. Okay, at the end of your day, all right? And we're also going to, I think maybe on our next episode, we're going to show you the other, I believe, essential stretch, besides McKenzie, that you need to do to take care of the upper part of the body. Okay? Little teaser there, okay? But we just want you to stay tuned in with us, and please join us for our next live. Again, from everyone here at Pain Free Orlando, we appreciate your time. We appreciate you. Let's stay healthy and all, live long and prosper. Okay? Thanks again for joining us. Have a great day, everybody.